Veterinary medicine is a messy business both physically and emotionally. Explaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFadden as she delves deep into the medical and business aspects of veterinary medicine.
And for the last in the trilogy of vaccination podcasts, we will talk about non-core vaccines for canine and feline patients. These vaccines are only given if the patient has a high risk of exposure. We're going to switch it up a little bit and we'll talk about cats first. There's really only one non-core vaccine worth mentioning, and that's the feline leukemia. The FIV, which is the feline immunodeficiency virus, chlamydiophila, the FIP, which is the feline infectious peritonitis, and the Bordetella are either ineffective or unnecessary vaccines, in my opinion, so it's really not worth mentioning any further. And I'll probably talk about a lot of those diseases in more detail in other podcasts, so you're just going to have to keep listening if you want to learn more. FELV is an immunodeficiency virus that is life-limiting and has been linked to certain types of cancers. And it is spread through bites and the blood of infected cats. Indoor-outdoor cats or outdoor-only cats are really the only ones who need to be vaccinated. If you have an indoor-only cat without exposure to other potentially unvaccinated cats, then they don't need the vaccine. We use the PureVax feline leukemia, which is a non-adjuvanted recombinant canary pox vectored feline leukemia vaccine, which stimulates good immunity. The problem is the immunity only has been proven to last a year, so annual vaccination is needed. All kittens should be tested for feline leukemia and FIV after 9 weeks of age, and then ideally again at 6 months of age. And you always want to test before you vaccinate them for the first time. This goes for adult cats as well. Kittens and adults with increased risk of exposure, or kittens whose parents plan to let them outside, should be vaccinated. And the initial vaccine series are 2 injections 3 weeks apart. Generally, I personally give my feline distemper and rabies vaccines first, and then after that series is finished, I'll start the feline leukemia vaccine series. Interestingly enough, the feline leukemia vaccine was originally thought to be the only cause of those vaccine-associated sarcomas we talked about in the first vaccine podcast, until we realized that it's probably the adjuvant that's causing it. And then we realized it's probably the adjuvant, but there's probably other things too. So the non-core canine vaccines that I think are pertinent include Bordetella, Lyme, and leptospirosis. And just in case you hear a little tip-tip-tap, clappity-clap in the background, that is my dog pacing in my study because he's bored, but if I let him out, then he barks to get in, and it's also a reminder that I need to trim his nails. And some people may say, what about canine influenza? In my opinion, it's a good idea in theory, but I don't really know how many dogs actually need the vaccine. And that's coming from someone who was in Chicago in 2008 when they had that first horrific outbreak of canine influenza. The problem is that not every pet needs it. Pets exposed to high volumes of other pets, like dog shows, huge boarding facilities, or even really big regional agility trials, are at the highest risk of exposure, and you may want to consider vaccination in that case. But the average run-of-the-mill companion animal pet has a very low risk of exposure. So you have to ask yourself and talk to your veterinarian about the risk of over-vaccination versus the need. And if you really want the vaccine, or your veterinarian really feels like your pet should have the vaccine, then by all means, go for it. But I'm not convinced it's super necessary. You also need to keep in mind that there's 2 known strains of canine influenza. There's the original H3N2, and then there's the newer H3N8. And there's vaccines that contain one or both strains. So the next question you should ask yourself is, what strain is my veterinarian using? If it is the one that's active now, great. If it's the one that's not active now, well, that's not super helpful. Or is it a vaccine that contains both? Those are all excellent questions that would prompt a great discussion with your veterinarian. Bordetella bronchoseptica is one bacterial component of kennel cough, aka canine infectious respiratory disease complex. And as we discussed before, kennel cough can be caused by a bunch of different viruses and a bunch of different bacterial infections. And aside from the annoying cough and sneezing, runny nose, and eye discharge, it can potentially lead to pneumonia and become very serious. Bordetella and some of the other viruses can kill the hairs that are called cilia that line the inside of your trachea, also known as your windpipe. And the purpose of these hairs is they're constantly moving upward, and they bring up all the gunk, like the dust that we inhale, and that way it doesn't go into our lungs. And when those hairs die, that gunk can go down into our lungs, or it can kind of fester in the middle of the trachea, and it can cause that classic kind of goose honk cough. The death of the cilia also means that bacteria can creep down into the lungs, causing pneumonia. And while the bacterial infection can potentially cause serious clinical signs, it's not the only cause, remember? And people get super focused on Bordetella as the only cause of kennel cough, and then they get really surprised if their pet's vaccinated and then there's an outbreak of kennel cough. We have to keep in mind that vaccine's not 100%. It's not the only cause. The goal of vaccination is to prevent the disease ideally, but in cases of multifactorial illness, it really is meant to minimize the severity of the illness. Because this is the non-core section, only dogs with increased risk of exposure should be vaccinated against Bordetella. So who's at risk? Dogs that are around a lot of other dogs. And kennel cough is spread through respiratory secretions, so you got to be around other dogs to get it. And this means dogs that are boarding, dogs that go to grooming and stay for hours, doggy daycare, dog park, show dogs, agility dogs. So if you and your veterinarian have decided that your dog's at risk for increased exposure to Bordetella and you want to get the vaccine, the next question is, which vaccine do you get? There's injectable, intranasal, and oral. I personally use the oral. The injectable vaccine, honestly, is not very effective, and you have to do it every 6 months. So in my opinion, totally not worth it. The oral and intranasal vaccine are actually equally as effective, and the only reason I choose the oral is because of ease of administration. Dogs in general would much rather prefer you squirt something into the back of their throat than up their nose. And when I would give intranasal vaccines to like your squish-faced dogs, like a pug, I always felt like it was like the veterinarian version of waterboarding because like they can't breathe and there's all this like snuffling and snorting. And then inevitably, I always get vaccinated when I give Bordetella intranasally because you squirt something up a dog's nose. What is their natural reaction? To sneeze in your face. When I started doing the oral Bordetella vaccines, I noticed I got vaccinated far less. I don't really think it does anything for people. It's not harmful or helpful, but it's nice not to be sneezed on. I use the Marielle oral Bordetella. It contains a live non-pathogenic version of the bacteria, which means it's not going to cause infection. And the nice thing about oral and intranasal is they cause a local immune response. So the back of the throat, called the oropharynx, it creates local antibodies. Because after all, how do you get Bordetella? Through respiratory secretions. So if the immunity is in the back of your throat, as soon as that area sees the bacteria, bam, it neutralizes it. Dogs cannot get the disease from the vaccine, but they can sometimes have local irritation from the vaccine. So they can have signs similar to signs of kennel cough. I see that more commonly with the intranasal than I do with the oral, but every once in a while I still get a client that calls and says, you gave my dog kennel cough. And what happens is that the back of the throat, or in the case of the intranasal, the inside of the nose gets irritated. They get sneezing and coughing for a couple of days after the vaccine, but it usually goes away. I personally believe all puppies should get Bordetella vaccines. And with the oral version, you only need one shot. It works within 3 days, and it lasts for 12 months. And because it's local immunity, you can bypass all the maternal antibody nonsense. And the reason I say puppies should get it is because everyone likes seeing puppies. And even if you limit the exposure of other dogs, you often don't limit the exposure of other people. And a lot of those people own dogs who could potentially be carrying the virus or bacterial particles on their person, and they can be acting as a fomite. And a fomite is basically an inanimate object that carries germs. And I really wanted to name our child Fomite, but I was totally outvoted by my husband and really everyone in my family. Although since he started daycare, he's totally a Fomite. Also, many puppies go to puppy classes, and they have a higher risk of exposure there, so it's a good idea just to go ahead and get them vaccinated. Unfortunately, as a general rule, bacterial vaccines really only last for about 12 months. The immunity that they generate, for some reason, those antibodies are only around for about a year. So that means you have to vaccinate them every year. The nice thing about the Bordetella is because it works within 72 hours of administration, you can really use it as needed. So let's say you gave it to your pet because you were going out of the country and you boarded them. 3 years go by, you don't need to board your pet, and then all of a sudden you need to board them again. Well, you don't have to, in that in-between time, get the vaccine because your pet does not have necessarily exposure. So now we're going to move on to Lyme and leptospirosis. And just so you're aware, I will definitely have a podcast on each of those topics, so I'm going to try and keep it short-ish. So Lyme disease is an infection with the bacteria Borrelia burgdorferi, and the bacteria spread through tick bites from the deer tick, or also known as the black-legged tick, and the fancy scientific name is Ixodes scapularis. And the infection occurs when a tick is attached, feeding, and alive for 24 to 48 hours. And all stages of the tick, from the tiny nymph to the bigger adult, can spread Lyme disease. And there is still a lot that we don't know about Lyme disease in the dog. And so many dogs appear to become infected with the bacteria and never show clinical signs. It's unclear if these dogs completely clear the infection or they just live with a low level of bacteria in their system and just never get sick. But if a dog does get sick from Lyme disease, it usually presents as fever, lameness. Usually it seems to switch legs, so we call it shifting leg lameness, and they can have swollen joints. Rarely, Lyme disease can cause neurologic problems or heart issues. Another rare but potentially fatal consequence of Lyme disease is a form of kidney disease that usually ends up in kidney failure called Lyme nephritis. So there's 3 lines of defense when we talk about prevention of Lyme disease. And there's 2 lines of defense when we talk about other tick-borne diseases. But tick checks first and foremost. If you check your dog every day for ticks, head to tail, and you find them and you remove them, then you prevent the transfer of Lyme disease. A lot of people have super thick-coated dogs, or they have dogs with black fur, and it can be really challenging. Flea and tick prevention is your second line of defense. It's extremely helpful in preventing the spread of disease by both fleas and ticks. And keep in mind, again, there's other tick-borne diseases. There's things like Rocky Mountain spotted fever, babesia, anaplasma, Ehrlichia that we don't have vaccinations for. So we definitely want to prevent tick-borne illness. At Independent Hill, we carry Frontline Gold, which is a topical agent, and NexGard, which is an oral agent. And NexGard is actually, what's really cool is it's recently been labeled as an effective preventative against Lyme disease. So the last line of defense against Lyme disease is the vaccine. Pets with an increased risk of exposure to ticks, especially in Northern Virginia where I am, should consider receiving the Lyme vaccine. So there's huge controversy right now over the type of Lyme vaccine people should be using. And one of the original Lyme vaccines that was invented used a protein called OSPA, or outer surface protein A. And this is a protein produced by the bacteria when it lives inside the tick. And then once the bacteria leaves the tick, it no longer makes that protein. So the Mariel Recombatech Lyme vaccine, which is what we carry, contains a non-adjuvanted formulation of OSPA. So this means when a tick infected with Lyme disease bites a dog that has been vaccinated against Lyme disease, the tick spits out its grossness into the dog, sucks in a little bit of blood. That vaccine is then sucked up in the blood, and then it goes into the tick and kills the bacteria inside the tick, which is pretty cool and pretty weird. And it theoretically means if that tick bites that dog, lives, leaves, then it no longer is carrying Lyme disease, and so if it reproduces, it can't pass on Lyme disease. So the concern has become, what if the bacteria gets inside of the dog before the vaccine has time to kill it while it's inside the tick? And this is a valid concern. The efficacy of the Recombatech vaccine that I mentioned is really good, and the company stands behind their product, and they actually have a guarantee that it will prevent Lyme disease in your pet. But a lot of drug companies said there has to be more that we can do. So they found that there's tons of these outer surface proteins, and there's one called OSPC, which is a protein that's produced by the bacteria when it's inside the dog. And so they figured if you develop a vaccine against OSPC, now you can kill the bacteria inside the dog. And that's great in theory. The problem is that there are a bunch of different types of OSPC, and unless you have a little bit of all of those types of OSPC, you may not effectively kill the bacteria inside the dog. So then there are some vaccines that have both OSPA and OSPC, which you figure that's awesome. That covers both of your bases. But the problem, again, with the OSPC is it may not work, and the immunity may not last the full 12 months, unlike the OSPA version, which we know lasts for 12 months. The question becomes, is it worth carrying the vaccine that has OSPC and OSPA, or is it worth sticking with what you have and what has shown to work? In my case, we're sticking with what we have. It doesn't mean we may not change in the future, but I just don't think that there's enough really good data saying that that OSPC addition to the vaccine really, really helps and is really worth it. And the other thing that's frustrating is, let's say I switch, right? The dog's immune system has never seen OSPC before. So we have to then say to a client, hey, your dog's been getting the annual Lyme vaccine this whole time. We've changed vaccines. I'm going to give it. You have to come back in 3 weeks because I have to booster it.